Hi everyone, my name is Dr. Jennifer Jackson. I'm a registered nurse and an assistant professor in the Faculty of Nursing at the University of Calgary. And I am going to speak with you today about qualitative research designs. I'm using the closed captioning today, so it's not perfect, but it's in effort to make these presentations more accessible and hopefully more useful for students. So today we're talking about qualitative research designs. I'm going to begin by talking about qualitative research in general, and then in a second video there will be some specific discussion around different types of qualitative research. So qualitative research is often contrasted with quantitative research. So these are both kinds of research that are used in a variety of fields, in the humanities, in different types of science, and as well in nursing. And it's very important to remember that one is not better than the other. So we need both qualitative and quantitative research to fully understand a lived experience and how we can provide better care. So for example, when we see COVID, we can think about using quantitative research, which studies quantities to look at how many new cases are there, how many people have been admitted to intensive care, and we can look across large groups of people and better understand what's happening in our society. In contrast, qualitative research studies the quality of something, if you will, and looks at small groups with their specific experiences. So picking up the COVID example, we can look and say, actually, we can have two people who are both diagnosed with COVID. However, one person may be sick for a couple of days, lying on the couch, feel a bit unwell, but generally be okay. The other person might be in intensive care. But when we look at the statistics, this will count as 2 cases of COVID. So qualitative research is what can tell us what the experience of these 2 different situations would be like, and it provides that richness and detail that helps us make sense of numbers. So it's important to be able to distinguish which is qualitative and which is quantitative, but it's important to remember that that distinction does not imply value, so one is not better than the other. They both have a role in how we provide health services. So we want to think about methodology versus methods. Sometimes these words are used interchangeably in research, but really they are 2 different things. So we'll clarify this point now and then see how that applies as we're talking more throughout this video. So methodology is the overall approach to research, whereas methods are very specific tools or techniques. So you need to make sure that you have good alignment between your methodology and your methods, and as well as the philosophical concepts that you're using to make sure that you have what we call the golden thread that runs through your research. So for example, if you are going to a concert hall to hear classical music, you will have somebody who is probably playing a violin, reading sheet music. Those are all specifics that you would expect to see with a classical music concert. So the methodology would be classical music, and the methods would be the oboe, the violin, the cello, the drums, and the sheet music. Those would all be specific tools that are used to make the classical music happen. Now, if you have the orchestra, like in the picture, and you're using tools like we discussed, then you're going to have a great concert. However, if you show up for a classical music concert and there are a lot of electric guitars, then something might be a little bit off. It might not fit very well, and the sound might not be what you expect. Now, if you're a very skilled musician, you can mix electric guitar in with classical music. But for the most part, those are two separate things. So generally, we find with a given methodology, there's specific research methods that you tend to use. And some really skilled researchers can weave back and forth and borrow from one another. But generally, it's important to recognize that we've got good alignment between the methodology and the methods, and that those fit with the ontology and epistemology of the study. Now, why we talk about alignment is this is very important for research appraisal. So one of the things we need to check when we're appraising an article is if there is alignment between methodology and methods. So if they have said that their methodology is to look at the lived experience of what it's like to have cancer in childhood, but then the method is a survey, that isn't going to tell us as much about the lived experience as, say, an interview would. So when we're appraising research, we're checking to make sure, do all these things fit together? And is this a group that reflects how you would approach this type of research? So I'm going to talk about some general principles in qualitative research that tend to apply no matter what methodology you're using. So these things lean a bit more towards methods. They're different tools you can use, but they apply for lots of different methodologies. So this is an overview of qualitative research. So when we look at sampling, we're thinking about who we're working with when we have our qualitative studies. So with qualitative studies, we're going to be asking open-ended questions, and these open-ended questions are going to help us better understand phenomena. So in a quantitative study, we're often going to be testing a hypothesis or measuring something. And in qualitative studies, we're going to ask open-ended questions to better understand an experience. So in order to do that, we need to make sure that the people we're talking to are experts in the thing that we are trying to study. So you've seen from your quantitative lecture that often quantitative sampling is random or based on relative proportions of a population. So that's where you get a randomized controlled trial. In qualitative studies, the sampling is not random at all. So if you're studying childhood cancer, you want to talk to people who have had cancer during their childhoods. You need to find experts, and it's very deliberate. Rather than trying to get a cross-section of society, you're trying to access people with specific knowledge and experiences. So the sampling strategies that are used in qualitative are generally purposive rather than random. You want convenience sampling, so you need people who are practically available that you can quite easily access and talk to. And you can also use a technique called snowball sampling. So a participant refers other people to the study. So what this looks like is that you can talk to someone, maybe they have some really interesting insights to share with you. And then at the end of the interview, you could say, how would you feel if I spoke to other people? Is there somebody that you could suggest that I could talk to who might be able to share other information? So maybe, can you tell me about a friend you had who's been through the same thing, or a coworker, something along those lines. So whereas in quantitative studies, you can do a calculation to see how many people you need. In qualitative studies, you're going to need much lower numbers. However, you still need to have really what we would say is rich data. So you could talk to maybe 5 people, and that could be enough participants in your study. But for those 5 people, you would probably want to talk to them 2 or 3 times so that you can really understand their views on the research topic. Other qualitative studies have between 10 and 20 people. It would be rare to see a qualitative study with kind of more than 30. It would also be quite rare to see fewer than 5. So there can be exceptions to that, but generally we're talking about much smaller numbers. But that doesn't mean that the research is lower quality. It means that we're doing something fundamentally different than a large population level survey. You may see the word saturation. What this means is that the researchers have tried to, based on the people that they're speaking with, they have tried to understand all elements of their perspective on the research. So you're not going until you hit a certain number or have a certain length of time. You are continuing to collect data until you get to know the story of a given topic. So when we think about data collection in qualitative research, we want to be thinking about a few different types of ways we collect data, but generally it involves you as the researcher going out and collecting the data. So instead of sending out a survey and anybody can answer it, it can be a lot more active process because you are working with the participants to come up with the data that you're going to analyze. So for example, you might work on using interviewing or talking to generate data. So you may talk to one person and have specific questions that you ask. You also may bring a group of people together, and that would be called a focus group. And so you ask them questions about their research, and you can see what different people in the group say, and they may interact amongst each other and bring out new ideas. In some studies, you have observation, and this is generally participant or non-participant. So observation occurs when you are watching and observing what's happening. So if you are a participant observer, you might be part of the action. So this would be somebody who is working as a nurse, and they are going around and helping to make beds and watch nurses give medication. They might talk with patients. They're very involved in the action. A non-participant observer would be somebody who is sitting in a chair, not speaking with anyone, watching life in the unit unfold. So that is one way that we can look at different styles of observation. And this reinforces that whether you're speaking with one person or a group, whether you're a participant or not a participant, it changes the kind of information you can receive. But generally, they're all very involved in active ways of collecting data. This is also the most fun part, generally, of doing a qualitative research study. You can also do things with text or images. So for example, you could take all of the legislative documents where elected officials have talked about nursing salaries, and you could do analysis of the types of words that they're using to talk about nurses. You can also have things that participants create. So I know of studies where they've said, take a camera and take a picture of something that gives you hope. And then part of the research is developing those pictures, and then the participant explaining why they took a picture of that thing to demonstrate hope. So there's lots of different techniques that you can use, and these are some of the ways that qualitative researchers are active in data collection. When it comes to data analysis, there are different techniques, but what you want to do is look for meaningful patterns across different experiences. So we generally, even if there's different types of data collection, text analysis is one of the main things that people do. And so I'll give an example. So I interviewed a nurse who worked as a research coordinator in a hospital, and I'll give you a moment to read this quote. This was something that that person had said during the interview. So this was something that the participant shared with me, and then it was my job to identify patterns in this conversation that could relate to the questions I was asking. So this is what this text might look like after you've done some coding. And coding is the process of identifying a unit of information that you want to highlight and associate with other units of information. So what I've highlighted here is that this nurse is saying some people are aware that we do research, but they don't understand it. That you're very involved, you have to be very careful to maintain data integrity, its accuracy, but the perception is that because you're not running around in the hospital, you're not doing anything, or you're not doing real work. So the things I've highlighted here are a stepping stone towards comparing this interview with other interviews to say, what is this participant's experience? You know, they're talking about high quality integrity in their work, but that's not what other people understand about their work and how they feel about that. And then what is this like compared to the other interviews? Do other nurses feel the same? Do they feel differently? Why might they feel differently? Is there a context different? And so this gives you an idea of the type of analysis you might be doing. And this contrasts with analysis where you are running mathematical calculations. This is about something different. Identifying those key patterns, key emotions, and the way that people talk about the things they've experienced. So these are some pictures from my research. Inevitably, qualitative researchers are well known for having a large supply of multicolored pens. I've got my research tool here with all my different colored Sharpies. We have Post-it notes, we have all kinds of things. So rather than running mathematical calculations, we tend to draw a lot of diagrams or make visuals, whether they be digital or on paper, to understand the relationship of how do these ideas come together. And initially, you'll see here that we've got the first picture is pretty messy, all over the place, a million different ideas. Over time, they start to become, the second picture is a little bit clearer, things are a little bit more organized. And in the end, you end up with a nice, precise, finished package, and that's the findings from your research. But getting there is not necessarily a nice, neat type of process. So this just shows this is some of the messiness that happens behind the scenes in order to present clear, useful research findings. So when we're thinking about these approaches, just to conclude how we're thinking about general approaches to qualitative work, it's important to remember that the qualitative researchers they value their participants' experiences, and they want to understand something through the eyes of a person who is living it or who has experienced it. So it's not about large groups and big populations and what is the experience of someone who has had something versus someone who hasn't. This is about life in context and life as lived. We're not testing hypotheses or changing different environmental conditions. We're trying to understand people, and through that understanding, share knowledge and build better health services and better ways that we can support patients.